Welcome back to our special programme on the coronavirus outbreak. We're answering your questions with an expert panel.
They are Iain Campbell, Secretary General of the Independent Health Professionals Association, who's joining us from Glasgow as this evening. We've got the Telegraph's Deputy Head of Travel, that's Nick Trend, who's in central London.
And in the studio, Mark Fielder, Professor of Micromedical Biology at Kingston University. And Mark, we'll turn to you with the next question, and it's about a baby's immunisation. My baby's 3 months old. He hasn't had all his vaccinations yet, won't have a very strong immune system. If he catches the virus, is he safe?
It would appear at the moment from data that's coming in that children are remarkably unaffected, and especially the very young. So there's lots of questions about why that might be, and I don't think we fully know the answer yet, but it does appear that the infection rate and very pleasingly the morbidity rate, the death rate rather, is very, very low. In fact, I think if I remember correctly, 0 to 9, it's 0%. So children seem markedly unaffected. And that may be because they haven't got some of the receptors they need to bind the virus, which is a good thing. It may be for other reasons, but children are markedly unaffected. So whilst maintaining the hand washing method and message and the cleanliness message, I think children should be relatively safe.
In a word, and rather selfishly, does that include kids with asthma?
I think then we're into the realms of having people with underlying health conditions. Okay. So I think on the air of caution, our physician colleague might answer this better than me, but I think we would look more carefully.
OK. Yeah.
I was just going to put that to Iain, because lots of people have asked for clarifications about what are these underlying health conditions. Is it the groups that we were talking about earlier?
Exactly, the groups we were talking about earlier, and I would echo my colleague's comments there that all the evidence we've got thus far, and it's obviously this is an emerging new infection, but all the evidence we've got thus far suggests that children are in a far lower risk group. Indeed, what we see with most conditions, not this one, is that parents often catch them from their children. What we're seeing in this condition is the other way around. We're seeing that it's often parents catch it first and give it to their children. And even then, children tend to have very mild disease, often even asymptomatic. So I guess what I would say is, thankfully, they're in a lower risk group.
Iain, we'll just come back to another question in just a moment, but just a line from the COVID meeting that's been happening today. The Prime Minister's spokesman says the PM chaired the emergency COVID meeting, discussed a range of steps which could be introduced to contain and delay coronavirus. This is, I suppose, the significant line. It says we remain in the containment phase, but now it's accepted that coronavirus will spread in a significant way. We remain in the contain phase. That's the headline there. Iain Campbell, just back to you. We've got somebody asking whether a swimming pool poses any risk. If you go swimming, is the virus something you can pick up there?
So I think it's very much we're not 100% certain of all these things. Hard surfaces are more of a risk, so I might even be more worried about some of the fixtures around the swimming pool than the swimming pool itself. The worst thing about all this is that you are infected when you can be mildly symptomatic or asymptomatic. So many people could be going to these places and touching things without necessarily sort of being aware that they are shedding the virus and leaving it behind in things they touch. That said, I suppose a swimming pool is in many ways like taking a bath. So in some ways, it might even help to rinse some things. Also,
I'm hoping that signal's not frozen. I was just going to ask you how long you think the
fixtures and things like that people have touched around you.
Yeah. We just, our bandwidth isn't quite up to muster at the moment, so you're just freezing a little bit there, Iain. I was just going to ask about the period in which people can be asymptomatic for. Do we have a sense yet of how long you've got it, but you're not actually you may be spreading it, but symptomless?
So what we're seeing is roughly up to 2 weeks is the kind of normal thing. There are outliers. I mean, I think there was one case up to 27 days that we've seen so far. However, 2 weeks is broadly where most of the consensus is. Some people, it can even be just a few days. I don't know if my microbiology colleague will have more to say on that matter, but that appears to be what we are seeing. Roughly a kind of 2 week lag period before we can be sort of relatively certain that someone's come from a high risk area is not going to develop it, and that's certainly where the guidelines currently seem to sit.
Well, Mark, you're nodding here in the studio, so in total agreement. Let's get another travel question to Nick Trend from The Telegraph. What are my rights if my employer wants me to travel abroad for business meetings, but I'd like to avoid airports and flights as I'm quite worried about it? Can I refuse to go?
Well, that's more of an employment law question, I think. I actually don't know the answer to that. Certainly your employer would have a duty of care, so I think you'd have a fairly strong argument, and I think it would be unusual if an employer were to insist in that situation, but I would talk to your union if you're a member of union. I mean, one of the other problems which has come up recently is if you're booked to go on holiday and you decide you want to go on holiday, but your employer wants you to self-isolate after you return, that's another area which is causing potential problems. And to be honest, I'm not sure if there is any legal clarity over in these cases. And I guess everyone's just going to have to talk and be sensible, but it's causing quite a lot of anxiety out there.
OK, Nick, thanks very much.
Mark, how much the question runs, I'm not sure who this question's from, but how much closer are they to finding a cure for coronavirus? I mean, I suppose the better question might be a vaccine.
Well, let's take both of those. A cure, at the moment, there isn't one. We're still working on basically treating symptoms and supporting the patient's symptoms, so allowing the immune system time to get over the infection. And that seems to be working quite well. I mean, one thing that's not often mentioned, there's something like 62,000 people out of the 111,000 that have been infected who've recovered, and they recovered and gone home. Yeah. That's not to ignore the people who are left, but that's a real thing to celebrate. So the people can recover, and we are treating people successfully by supporting them during the course of the symptoms that they've got. There are some trials looking at certain anti-HIV drugs which seem to be working to stop the virus as well, because they've both got the same type of genome. It's an RNA genome, not a DNA genome, and that seems to be some rays of hope there. As far as the vaccine's concerned, if I'm honest, I think we're probably not going to have a vaccine for this outbreak, but we will have one hopefully for future outbreaks to protect people in the future. And
if you were one of those people who panicked the last time and bought a stock of Tamiflu, is it any good?
Probably not for this virus, I would think. I'm not entirely sure, but I think it probably wouldn't be. I think it's very important that they're focusing on these anti-HIV drugs at the moment to see if they can be repurposed and used in the coronavirus cases.
OK. Mark Fielder and our other two guests joining us from Glasgow and Central London, Iain Campbell and Nick Trent. Thanks all very much indeed for joining us today. More questions to come, I'm sure, in the days to come.
Yes, indeed. You're watching Sky News Today. Coming up, we're going to be crossing back live to Italy, now home to the most